Hi, this is Ken Chang. I'm the Chief of Gastroenterology and Director of our Comprehensive Digestive Disease Center here at UC Irvine in sunny Southern California. I'd like to invite you into our new interventional endoscopy suite where I'll be performing a transoral incisionless fundoplication or TIF procedure using the new Esophax Z Plus device. Endoluminal therapy can be a real solution for patients in which surgery is too invasive and not necessary, while medications are either not working or having unacceptable side effects. We know that patients with GERD are on a spectrum of anatomic alterations. Patients who have a large hiatal hernia certainly require surgical intervention, but in the beginning of the spectrum with a fairly normal anatomy, the dynamic failure, or patients who have a small hernia and a loose lower esophageal sphincter, this is where endoluminal therapy really fit in nicely and offer the patients a great alternative to surgical solution. It's very reassuring for me and gives me the confidence to offer patients the TIF procedure because the safety profile is so good. We now have data extending over 20,000 procedures in which the adverse event rate is less than 1%, approximately 0.4%. Patients feel very comfortable giving consent for such a procedure. Immediately post-TIF procedure, patients may complain of a sore throat, some mild epigastric discomfort, possibly some esophageal spasm. These symptoms are temporal and short-lived, usually in the order of a few days, perhaps 1 to 2 weeks max, and patients in general tolerate it very well. My patients are attracted to the TIF procedure because essentially everything that the TIF procedure does mimics the mechanism of the tried and true Nissen fundoplication, yet they can get the same results with an endoscopic, minimally invasive procedure. The typical TIF procedure takes less than 60 minutes, so it's very doable from a time point of view as well as an efficiency point of view. Regurgitation really is challenging in patients with GERD because the PPIs can take away the burning sensation, but oftentimes the troublesome regurgitation continues unabated. And this is where the TIF procedure has been shown in level 1 clinical trials to be quite effective at reducing the troublesome regurgitation. To me, it's quite exciting as patients come back for follow-up, and I can already anticipate giving the patient good news that they can come off their PPIs, and in my clinical experience, greater than 80% of my patients can come completely off their PPIs, and that's a good thing. Now it's come to the point where gastroenterologists can really master this and be able to offer something to patients that we couldn't offer before. This patient is a 68-year-old male with a history of chronic GERD and Barrett's, leading to high-grade dysplasia and early esophageal adenocarcinoma. The patient underwent an endoscopic mucosal resection in 2011, followed by a series of radiofrequency ablation until the patient reached CRIM in late 2012. Since then, the patient has been essentially Barrett's free, but requiring high-dose PPIs and still having inadequate control of his GERD symptoms. In July of this year, we performed a Apollo overstitch procedure to try to tighten the G junction. That was partially effective, but the patient is still PPI dependent and still has breakthrough symptoms of heartburn and regurgitation. The patient is now here for an esophax TIF procedure using the new Z Plus device. So no esophagitis. Gastric fluid is clear. We're going to aspirate some fluid to check a pH. We have mild gastropathy, antral gastropathy. The pylorus is open. D2 looks fine. Take a second pass at D1. D1 looks fine. And we're going to insufflate and do a retroflex maneuver. Maybe a small erosion up top. And it's looking like a Hale grade, maybe 2. A 1 to 2, just a slight looseness around the scope. What was the gastric pH?
5.5.
Gastric pH 5.5. So he is on Dexalant. So with reasonable control of his acid. But despite that, he has symptomatic breakthrough acid reflux. The Z line looks fine. No signs of any residual Barrett's. Yeah, maybe some very mild esophagitis there, yeah. All right, let's measure some landmarks. So first landmark is the diaphragmatic pinch. We're getting right here at 42. And top of the gastric folds, yeah, also pretty much 42. And squamous columnar junction, and 41. So no hiatal hernia to speak of. His valve is loose, and he's got a Hale grade 2, scope diameter of about 1.5. So now we're going to go ahead and put the guide wire in and insert the Savory dilator. Okay, we got 1, 2, 3, 4. Yeah, perfect. Savory coming down. This is a 54 French. We do this really just to open up the hypopharynx and the upper esophageal sphincter. It's not meant to dilate the G junction. I'm going to put that about a third of the way down. That's perfect. So we have the patient in a supine position. That facilitates draw thrust and inserting the device. But for endoscopy in general, I like a little bit of a left tilt. So this is the compromised position of a supine, slightly left tilt.
Going to be applying approximately 3 cc's through the lumen of the device. And applying through the tip of the device as well. Another 3 cc's. Opening fasteners, 7.5 millimeter.
So this is the GIF H190. So it's a 190 series 2.8 channel adult gastroscope. It's important to minimize the amount of oil spillage onto the handling of the device. Using gauze, I'm going to grab the other tip of the scope, so it minimizes handling the device itself. And you can see that by gravity, the big knob is already facing down, which is the correct position. So the savory bougie is coming out. And so this is what the orientation we want. We want this to be going over the tongue, the big knob facing down towards the patient's shoulder. Okay, scope is in the esophagus. As we get to the bending part, we're going to drop the endotracheal balloon. Okay, now we're just gently advancing that scope and device further down into the esophagus. So now the device is at 20. I've got lumen in front of me. I'm moving the scope tip to the body and antrum. The device is gliding nicely down. The device is at 30, 35, 40. Now I'm insufflating. I'm retroflexed. I can see the device here. I'll push the device in just slightly more. So now the device is at around 44, so this should be sufficient. I'm going to come back a little bit with the scope, and I can see the blue there. Okay. So now I know that I have enough device in the stomach. And now we're going to put the insufflator on. So the other thing is on here, we want to make sure that this is off, hold that, off to the top.
Okay.
Yeah. Okay.
Device is off.
So this is completely off, right?
Yes.
So we have the insufflator set for 18. This is the flow. So we have that at 30.
Yes.
Okay, so that's the flow. So we need to open the valve to let the CO2 in. And we can see it starting to open up nicely. So at this point, we want to orient the device so that it will open towards the greater curve. So now you want to just come back out of retroflex into the device. Okay, slowly come back to the blue. A little bit more, right there, stop, okay. Okay, now you're going to enter and come out through that opening. There we go. Okay, so I'm going to rotate posterior, and you're going to follow me. I think this is a good position. All right, so we're going to ready to advance the helix. One, two, three, four. Yeah, 4 turns. All right, so I've got good grasp on the helix, right? And now you're going to start desufflating. And as you desufflate, I'm going to start with tracting. I'm getting nice length here. Okay, now I'm going to go, stop here. I'm going to see how much wrap I can get. I'm going to slowly continue desufflating. Okay, that's a good amount right there. All right, so the invaginator is on now, and I'm going to go ahead and load and fire. Load the fastener. And we're going to fire now. And then reload. 1, 2. All right, so I'm going to come out of that corner. So now I'm going to open the helix a little bit. Okay. All right, so I've set the device, I'm at 40. I'm going to start desufflating. Yeah, so again, a nice length here. Let me see if I can rotate into the corner. The rotation is really nice. Oh yeah, that's what I need. Okay. All right, so let me lock that. Okay. Invaginator on. You can start insufflating. I'm going to push off the diaphragm just slightly. Okay. I'm going to fire here. And reload. Reload 1. Reload 2. Okay, I'm going to come out of that corner. Oh, that's nice. Okay. So that was the second bite. So now I'm going to loosen the helix and open the tissue mode a little bit. I'm going to set the device again. This time a little bit higher, 39. And this time I'm going to try to get a little bit more wrap than length. Length I seem to be able to get pretty well already. So I'm going to start desufflating. Oh yeah, that's what I wanted. Okay, yeah, I'm going to pull on the helix a little bit. Push. Okay, I got length now. You're going to re-insufflate. Vaginator's on. I'm going to push off the diaphragm. You're going to come around just a little bit. Right there. Okay, right there.
Okay, insufflating.
Okay, I'm going to push in. I'm going to go ahead and activate. Okay. Reload 1, reload 2. All right, so I'm going to come out of that corner. And you're going to come out this way a little bit. I'm going to open the tissue mold and release the helix. That was 3 bites on the posterior side. The helix is out. Okay. So we built some sort of valve. There's obviously more opportunities, a little bit floppy. Now I'm going to the anterior side. And you're going to come over to the posterior view. Yep. Okay. I'll grab right here. 1, 2, 3, 4. Now it's tight. 4 turns. And I'm going to go ahead and open and take out a little bit of slack. So I'm going to set the device. Now I'm at 40. I'm comfortable here. I've essentially covered the blue. So now we're going to desufflate. Okay, I've got a lot of length here. And now I'm going to turn into that corner a little bit. Keep desufflating. I'm at 40. I'm going to just push off the diaphragm slightly. Invaginator on.
Okay, invaginator's on.
And you're going to re-insufflate.
Insufflating.
Okay.
Insufflating.
And I'm going to go ahead and fire here.
Insufflating.
Okay. I'm going to reload. Reload 1. Reload 2. Valve is coming in beautifully. Very nice, very long. Okay, so that was bite 1. I'm going to set the device again. I'm going to go to 40. Now I'm going to start rotating into that corner. So keep on desufflating.
Desufflating. Desufflating. Desufflating. Desufflating. Desufflating. Desufflating. Desufflating.
Oh, that's a nice wrap. Okay. Lock. Okay, turn the insufflator back on. Vaginator's on. I'm going to push off the diaphragm. I'm going to fire. And I'm going to reload. Reload 1. Reload 2. So that was the second bite anteriorly. I'm going to come out of that corner. That looks nice. That's very nice. Okay. Get a little bit more length this time. Start desufflating. Okay, that's pretty much max length. Okay. And now let's see if I can get some wrap. So I'm going to rotate into the corner. Keep desufflating.
Desufflating.
Okay. Invaginator on.
Vaginator's on.
And re-insufflate. Okay, I'm going to rotate out of that corner a little bit. Okay, good. I'm going to fire here.
Vaginator off.
Okay. So that was the 6th bite, or the 3rd in the anterior. We're going to relax the helix, open the tissue mold. I'm going to go ahead and come off the tissue. So now we're going to go to 5 o'clock and get some length here. That's about 5 o'clock right there. And we're going to go ahead and put the retractor out. And grab right at the lip here. right there. Okay. 1, 2, 3, 4. Okay, nice and bunched up. And open it, then release it. So right now I'm at 41. So I want to get length. That's a nice long runway. Okay, so now we're going to start desufflating. And as you're desufflating, I'm going to work it down. Oh yeah, oh yeah. Come on, baby. Come on, come on, come on. Okay, nice. Okay.
Vaginator on.
Re-insufflate. I'm at 41, so I'm off the diaphragm, so I'm going to go ahead and fire here.
Vaginator on.
Okay, we're going to reload. Reload 1, reload 2, and now I'm going to open, let the helix out, make sure it's nice and tight. So we're going to just move over a slight bit. Okay, start desufflating.
Desufflating. Desufflating. Desufflating. Desufflating.
Yeah,
Desufflating.
yeah.
Desufflating.
Invaginator on.
Vaginator on.
Okay, you can re-insufflate. I'm going to get off the diaphragm, which I'm already at 41, 42, and I'm going to fire here. And reload.
Vaginator on.
I'm going to rotate off. Okay. I'm going to close, and I'm going to go to about 7 o'clock now. As you can see right down the middle there. Okay, that's nice and deep. So go ahead and start desufflating.
Desufflating. Desufflating.
Yes,
Desufflating.
yes, yes,
Desufflating.
yes, yes.
Desufflating.
Okay. Ooh, 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 that's max. Okay. So Invaginator on. All right, I'm going to fire here.
Okay. Vaginator on.
Reload 1, reload 2. All right. So we got to loosen that up. So let's start desufflating.
Desufflating. Desufflating.
Okay.
Desufflating.
Invaginator on.
Vaginator on.
Okay, I'm off the diaphragm. I'm going to fire. Okay, that was my second bite at 7, so that's 10 bites. Loading in the second cartridge.
Second part.
Load 1. Load 2. So let's take a look. Anterior is pretty good. So I want to focus more. Yeah, that looks pretty good. Right? Yeah, so let's focus more on the posterior side. Let me see if I can get the helix right in there. Yeah. 1, 2, 3, 4. Setting the device. Okay, I'm at 41. So let's start desufflating.
Desufflating. Desufflating. Desufflating. Desufflating. Desufflating. Desufflating. Desufflating.
Oh, I like that. Okay. Okay, there. Off. Block. Invaginator on.
Vaginator on.
Okay, I'm at 41. I'm good. Push off the diaphragm a little bit. I'm going to fire here.
Vaginator on.
Reload. Open it up and see how things are. So now let's take a look at that posterior side. Yeah, you see how we brought all that in? All right, so this is tight. Let's come around the other side. That looks pretty good too. Yeah, I think we're happy. Okay. So now I'm going to face the greater curve, and you're going to slowly come back into the scope, into the device. Keep going. Stop right there. I'll put my helix right there and lock it. So invaginator is completely off. No suction. Blue knob to the shoulders. I can see my helix. Slowly come back. Okay, device is out. I think it's fine. I mean, because here's our omega, right? It's at least 3 centimeters, right? It's pretty deep. Goes all the way around. So this is the distal extent, which is right about here. That's at 44. The proximal extent is here, which is 40. So we created about a 4 centimeter high pressure zone. Here, 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 here. Okay,